Welcome to all the Honduran population. Today we're going to speak about a very interesting topic within the Right Here, Right Now platform in Honduras. Sexually transmitted diseases, which are mostly known like sexually transmitted infections. So that's something we're going to talk about and we're going to broaden within this show. And we have to know how often we have to test ourselves, what are the questions that we have to ask ourselves as youth, and what should we do if we have an STI. So all of this is going to be addressed here today, and in this platform we have two people who know this topic really well, and not because they have gone through it, but because they have also studied it. And they are in constant updating of their knowledge with the new progress in science that has to do with STIs. So with us, we have Grecia O'Hara. She is the communications officer for Somos CDC. She started working for this organization in 2019. She is a graphic designer. She is an audiovisual producer, technician in counseling and HIV and syphilis rapid tests, and human rights defender. We also have with us Mr. Grosby Gomez. He belongs to the Policy Advocacy Program and Project Management, as well as the National Association for HIV and AIDS Forum. He has a bachelor's degree in psychology, in philosophy, and he's about to end his law school degree. He has gone through diploma courses from the Inter-American Court of Human Rights and CIPRODE. He also works on topics of sexual and reproductive rights for Forosida from the National Autonomous University of Honduras. He has also worked on natural catastrophes with the University of Chile and in comprehensive sexual education in the University of San Rafael. So as the first topic, I said sexually transmitted diseases. They corrected me, but not right now in the show, but prior to recording, because it's important to talk about infections, not diseases. So Grosby, can you clarify this term for me, please?
Okay, well, approximately between 12 to 15 years, the term disease was eliminated. First of all, diseases are related to, for example, viruses, for example, the flu or cough, and STIs are part of this virus family, but they're not transmitted in the same manner. The STIs are transmitted through direct blood contact, and that's when it becomes an infection because it becomes acute in the person, depending on the pre-existing condition or in their immune system. And that tends to become acute.
So it's an infection. So in case of Grecia, because we have another guest and we're going to introduce her. In case of Grecia, you work with the rapid tests for HIV and syphilis, right? Syphilis is not very known about, only HIV. Yes, it is an STI that has become invisible, because when we talk about STIs, usually we always think about HIV and we forget that there are other STIs that could be lethal, even faster than HIV. I had the opportunity to work for 2 years for an organization that works with rapid tests for HIV in terms of prevention and treatment. A year after I started working in the field with the syphilis rapid test to detect, prevent, and treat syphilis. So this is just an introduction that we are making in terms of this topic. We have another guest. She is in Argentina. She's Keren Donoway. Donoway, right? Yes. She's in charge of communications and youth for the Davis Foundation. She works for the platform and has been working for 3 years. And we're talking about the Right Here, Right Now platform in Honduras. She's a student in the last year of political sciences in the University of Buenos Aires. She's an activist with HIV people. And she works for this platform all the way from Argentina, supporting and fighting for the rights of a population. But now we are going to talk here in Honduras. How are these rights in Honduras? How is this disease known, and how has it evolved? How has the person taken the stigma out that if I am next to a person who has HIV, then I'm gonna get infected as well, because that used to be the thoughts, and that's still some of the mindset of people in this century.
For example, talking directly about HIV is too broad because in the 21st century, talking about reduction of stigma and discrimination has been more like in social media, like in Facebook, and you become a trending topic. That's basically stigma and discrimination.
Are we still ignorant about that?
It's not ignorance, it's directly the debt that the government has with its population. Since 1999, the special law created for HIV and reformed in 2015, the special law on HIV, particularly Articles 13 to 17, that speaks specifically about what organizations should include comprehensive sexual education. It's written by law. But unfortunately, in Honduras, we have very, very good laws, but they're in paper. For example, the special law on HIV has a governing body which should direct it. It should be coordinated by the Health Ministry and the Human Rights Ministry. But unfortunately, on
They're in paper.
empty paper, there's no money to sustain this law. Number two, there's a term which I personally, it's not of my liking. It's called political will. When there's no political will on regulating budgets, because it also happens that we like to work because of the trend and by action and not by prevention. So it's like basically the trend of HIV, and we're going out from this trend, so let's remove the money and the program disappears.
Grosby, how has this topic been during the COVID-19 pandemic?
Well, right now, talking about HIV during the pandemic is very complicated. To begin with, we don't have updated statistical data. We have until May, but because we demanded them, but not by will. We started to demand them basically to the AIDS Forum a long time, so we could talk about this and we could say we have this and we could fight for this. And to this day, till May, we have 38,055 people. But this is accumulated data from 1985 to May 2020 from the Health Ministry. So basically, they say there are 25,000, 26,000 direct cases, but in reality, there are many more because there is no work on the field. They're waiting for us as a HIV population that we go to the civil society, and civil society goes to the neighborhood and brings the patient, because directly the work for the health ministry is diluted. It's waiting for the secretaries that they would come and bring this patient.
You mentioned a key word, us.
Yes.
Are you inside this group?
Yeah, actually, inside the many questions you've asked, I'm a person with HIV, coming up to 4 years with, I'm young with HIV. I'm coming up to 4 years with HIV. I come from a very traditional family, very chauvinist, very patriarchal, but I had the luck to have a mother who taught me a lot of sexual education. And basically, I was in a school where I was taught sexual education, and this wasn't a choice. It was basically obliged. If not, you will lose your points.
So it was part of your points.
Yeah. So if not, goodbye. So my mom, I would be ashamed, and then at some point in time, and whenever there was civil society, when they were delivering condoms, yeah, 3 for you, my son. So I started to lose this embarrassment.
So she was open-minded, right?
Yeah, this in terms of, for example, in terms of sexuality. But in terms of being someone gay, that
So
was
it
very
was a hard time for your mom to accept that.
Yeah, it was hard for her. Within the family, she's the leader of the family.
So she has a strong temper.
Yeah, you can see from there she has a lot of rank within the family. So
But in spite, it was hard for her to understand or accept your
yeah, it was hard.
or your sexual orientation, right?
Yeah,
She has supported you.
yeah. They have supported me. My family has supported me. If you fall down, I'll help you get up.
Yeah, of course. So it makes you stronger.
Yeah, basically, I never had a condition of a closed life because of my HIV infection. Starting from my experience, when I got the positive for HIV, not only for me, but a lot of people, Grecia works with the tests for these kinds of news. It's very stressful.
It's horrible. We're going to speak with Grecia soon.
So in my case, I received it with more of a joke because they gave me an HIV leave in the private sector.
For that, so that leave, you think it's just to assimilate the disease?
You can give a diagnostic like that because there wasn't even pre-counseling about this. In 3 days, I wasn't going to be infection-free. So after this, they gave this to me, the results, and 3 days leave. And I have a platform in YouTube where I uploaded my videos. Without pre-counseling, I told it out loud without any problems. 20 minutes after doing all this, I called my mom, and I told her I got my results. They were positive, and the response from my mother was, "Did you enjoy it? Did you enjoy doing it?"
Yeah, I think that was her defense mechanism to that news.
Yeah, she said, "Did you enjoy it? Therefore, you should enjoy the rest of your life then." And that was basically it. And then we talked about our medicines, what I should take, what are you taking, and then how much does it cost. This process is like this, like that. But it was very open.
Okay, so we're going to continue talking about the topic and how you have fought with that, helping with other people that have HIV. But before that, we're going to allow Grecia to speak because you had already said that you do that rapid testing. And oftentimes you have had to say you are negative and you are positive as a result. Of course, if it's negative, it's a joy. But when it's positive, I can imagine that it is a hard news for you to give to the person, even though you haven't experienced with this. Can you tell us a little bit? Yes, to talk about this topic, I would like to share an experience that I had with a person in jail, a woman in jail, sorry. I cannot say the name because of confidentiality, but just for you to know what it feels like. She is a woman whose husband is also in prison, and the husband would leave the prison to visit her. So allegedly, the husband would only leave the prison to visit her, and it's it was supposed that they were only the two of them were having sexual intercourse. So the prison is where there's a lot of people. It's an overcrowded place. So it's hard to give pre-counseling or pre-advice to a lot of people around you, waiting for the result of that person who is living in that same cell as you. Because if that person is positive, then the rest of the people in the cell could take drastic measures, even killing her or beating her up. Well, it happened with COVID. We saw that with COVID there. Yes, that's correct. So in this case, we were taught a protocol to give this kind of diagnosis in these spaces because we don't have the absolute privacy that we need to provide the service. So when we had the positive result for this women, and that was my first positive result to give, and I cannot tell you that I felt like her because I don't know how that feels like, but my body was so cold because I didn't know how this person was going to react when I was going to tell her, you are HIV positive, and having to explain to her the next step. So throughout the process, we can identify if the person has a likelihood of being infected with HIV. So in this case, I had detected that there was a high likelihood because of everything she had told me. And when I got the positive result, I had to give it to her, and I tried to do it as humanely possible as I could. Do you do the rapid tests? Yes. We were trained to do the pre-counseling, the rapid test, and give the post-counseling. What is the difference between the rapid test and then like a normal test? For the rapid test, we get a result in 15 minutes. And with the other kind of test, it can be delayed between 5, 3, 8 days. Which one is more efficient? In terms of efficiency, both are 99% efficient. But in case of the rapid testing, there could be some kind of variance in a result, which is a false positive. And this could happen with certain kind of conditions in the blood, like lupus. It can create a false positive that we can get, and it could both happen with HIV and syphilis. So if we are in doubt, we make a second test, and if we have further doubt, there is a protocol that we can follow in order to verify 100%. Grecia, is there a high percentage of syphilis in our country? Yes. Usually HIV goes hand in hand with other STIs because HIV is a window of opportunity for STIs, which are called opportunistic infections. Because oftentimes people, when they get their result, they focus only on HIV, but they forget that in sexual intercourse that they haven't taken care of themselves, they could get another opportunistic STI, and it could create a further conflict than just HIV. So we have a lot of cases of syphilis. Out of 10 HIV tests, 7 or 8 people were positive for syphilis. Okay, why did you get into this world? Why did you start working with people with HIV? I had the experience of working with human rights with my mom. My mom had involved me from very young in human rights and the human part, and not only in sexual diversity, but all kinds of vulnerable population, like people in prison. And I went into jails when I was 7 years old. So I saw the human part of this. And the first time I approached sexual diversity was with the Kukulkan Association, and they were the ones that sponsored me. They were the first organization that I visited, and there was an opportunity, or there was a vacancy there to get involved with the rapid testing for HIV. And at that time, that process had just started. So I applied, I got the position, and I was able to work. I had never worked in health, but it was very interesting to me about that emotional part of the human beings. So that's an experience that marked my life. I met many people, I acquired a lot of knowledge, and I understood the value of life. Grecia, what is your sexual orientation? I could say that my sexual orientation is bisexual. So you can be with a man or a woman. Yes, I eat everything. A good grandma you have that she said that you eat everything. But did that encourage you to work more in this? No. In my case, it's very interesting because people always relate LGBTI with STIs. And I don't need to have a shirt saying I have this infection or the other infection. But if I went to a prison and they for sure asked me, but do you have HIV? Do you have AIDS? Do you have an infection? And why are you testing people and you don't have any of those? So the relationship between STIs and the LGBTI community is very close. So even though someone doesn't have an STI, the people usually think or assume they have one. That is why we are working with all of them. And you're okay, yes. So yes, of course, you don't have to be wearing a shirt saying, I have an infection or I don't have an infection. So I do the checkups, and I'm always aware that if someone looks at me in the street, they're going to ask me, he can have that, because they call me he, not her. He could have HIV or syphilis, because that's how people are. So it's living with a stigma. Do you feel you're discriminated against? Yes, it is a kind of discrimination, but I have to acknowledge that due to the context, the culture, and the education we have in our country, it becomes something that is part of our life. It shouldn't be like that. Do you get bothered with that or not? Not anymore. Does it affect you in any way? No? No, and what I try to do is just to raise awareness on people, because the first thing that we have to do is to sensitize people. And if the person doesn't want to understand, then we gave them the information and they can do whatever they want. Yes, well, I'm kidding, but yes. Well, I guess you follow up on them, right? Yes, that is because it's part of your job. So now you are a gay person. You live with HIV. What is your work? What is your objective within the platform?
Come as the full combo.
No, I mean, I know because you allowed me to ask whatever I wanted to.
Yeah, really, it results like, it's very funny what Grecia mentioned before. They associate that a person with HIV, directly or indirectly, like a gay person has everything. He basically has every infection, like the packages or the combos you buy at the fast food. And that's a constant struggle to begin with, because within the organization, we talk about stigma and discrimination. You have it by X or Y, but it becomes more acute when you're a gay man. My discrimination will go up. If you're a boy or a girl trans, it will go up. If you're Afro-descendant, it goes even higher. Discrimination goes even higher. Now let's add to this an STI. You're gone basically. For example, I don't use my HIV positive flag unless I am doing political advocacy, which was part of my job, which I did with my mentor, Xiomara Bu, which she taught me, and she told me, use this flag in these points in time. She was basically the mother for Keren, and she told me that whenever I came to the AIDS forum, you should use your flag in this manner. So when I have to do it for political incidents, political advocacy, and when they're talking about people with HIV, I'm not a number. I'm a person here.
I am a human being.
Exactly.
So this is your job.
Exactly. My job are basically political advocacy and public policies. We have very nice laws, but they are not complied with. So basically overseeing the political agenda and getting to know about the therapies going for HIV and what's happening with it, if it's changing, if they're changing, why are they changing? Then the fast tests that are done for the first, second, third, fourth generation, why are they doing this? And it's a struggle for every civil society organization to work in a response for VIH testing, the legal test that they do. For example, 93% of people with HIV in Honduras that have HIV in Honduras, they have no jobs. They do informal commerce, basically. So they can't come out with the pandemic. They can't come out and sell their things because everyone is afraid.
Of course.
So it reduces, our people with HIV live basically with $1, basically. And you had to add to this the medicines and the children they have. They have to think about feeding their children or buying medicine. So they basically get to the abandonment point. Every social line is affected.
So it affects all the family.
Every family and a lot of families. So then we'll start with the public policies. There's a pattern within the companies where they do HIV tests in a clandestine and illegal manner. You go to a company and they do all these tests, and they include the HIV test. And in the law, it says it should be voluntarily.
That's true.
Where I, as a person, decide if I want to do it.
And it's the same thing as when a girl is asked a pregnancy test when it started working there.
And that's about. There's I'll end the idea here. They do the test. They don't tell me I have HIV. They just don't call you.
They don't hire you anymore.
So basically, you're always looking for work. What you mentioned before, for women who are pregnant and take HIV tests, they have to do it because they ask for it as a requisite.
And not only HIV, but others too.
And at that point, you can defend it because it's trying to avoid the infection from mother to child. But then we reach a point where when we reach the obstetric violence, when C-section is done and no doctor wants to do the C-section because there is no biosecurity equipment and they have HIV. It has been a constant struggle for the AIDS Forum and every organization that have AIDS, and there's no biosecurity equipment. Doctors, it should be for every woman who's doing a C-section, your glasses, your mask, your gloves. Not only because they have HIV, but sometimes they say double glove like a condom.
Yes, it's for appendicitis, for anything, for even a minor surgery.
You say double gloves. You don't have to use a double condom. Like, for example, like a condom, you shouldn't use a double condom.
We're going to talk about that because I know that Rosby is talking a little bit more, but we're also waiting for our dear Keren. And she is located in Argentina, fighting for the rights in that country. So I know that Keren is also a person who lives with HIV. So now we're going to talk to her so she can tell us about her experience and about this interesting and important topic for all humankind. So we're going to go with Keren. So I started talking about HIV, STIs, sexuality ever since I was very young. I was an activist since I was 8 years old, very, very young, because I do understand the importance of other youth to have a comprehensive and lay sexual education. So when youth come to the time of having sexual intercourses, they can make the correct decisions and support each other. I started at 8 years old because I was born with HIV. And one of the ways to transfer HIV is through sexuality. So I've always had this important point in the agenda, which is so important to have the CSE, comprehensive sexual education, as well as lay education. Thank you very much, Karen. And we're going to speak further so you can tell us about your experiences. But we're going to go with this girl. It makes me excited to hear from you because you follow your grandma's advice. Of course, I follow my grandma's advice. She has helped me a lot. So what do you do? We're going to talk further about this. This is a very humane and deep work. Do you have a lot of friends who ask you about STIs? It is interesting because the friends that I have are all LGBTI. I don't have heterosexual friends, maybe two. And heterosexual, but you know a lot, but you only consider friends two of them, right? Yes, only two of them. In terms of the people who ask me about STIs, there aren't many because most of my friends know about this topic already. They have gone through the clinic. I have given assistance to most of them. So it's not like a relevant topic for us because they have had access to this information. They have gone and do the checkup and they are aware of going and getting those checkups. So for them, it's not something new to talk about STIs. And my heterosexual friends don't talk to me about that because out of shame. So one question for both of you. Do you think that youth don't get tested for STIs out of fear? They rather not knowing and just transferring the infection from person to person and having a domino effect? What do you think? Well,
there's a problem here, and we'll go into the legal subject in this subject matter.
That's why you're studying to become a lawyer, right?
Actually, there's a legal void. Ironically, in Honduras, at 18 years old, you can get a weapons license, but you can't do a HIV test. You need a legal guardian to do this, to give you permission to do this. In this case, my friend Grecia goes with a minor, and Grecia does the test. There's a legal problem there because the law does not permit this without a legal guardian. Ironically, our young population, 13, 14, 15, 16, 17, 18, 19, 20 years of age, have an active sexual life. And I'll talk about my experience. As you know, we do visits to different schools as long as we have authorization from parents and the school administrator. A long time ago, a young guy came to us outside of what we were doing there. Everyone was there, and a young guy approached and told me, "I need to talk to you, but we need to do it somewhere else." So he told me, "Let's go to the bathroom." I didn't like that idea. So I told a friend of mine who is a doctor to accompany me. So we go to the bathrooms, and we find ourselves with an infection and a gonorrhea on a second and third week. So the smell was terrible. So we told him, "What is this?" He didn't know about the infection at all.
Well, but he at least trusted you to ask what was happening to him after 3 weeks.
Yeah, because of the pain he felt, actually. Because it was not only the penis, but there was also pus coming out.
So it was spreading all over.
So we told him, "How old are you?" 15, he said. My first question was, "I know you have an active sexual life. In the last month, how many sexual partners have you had?" 4. Oof. In In a public school, yes. Four classmates from your school, we were at a party. We were doing a lot of things there.
So it was domino effect.
Yeah, basically a domino effect. So automatically we thought, where can we send them? The administrators from the school can't know because they're pastors. So where should we send them?
So you identified the possible other people who had the infection?
Yeah, but in the same way, they didn't want to get approached.
And that's something very important, Grecia. Where can a person go and get a checkup or testing to see if we have any STI, especially when we have an active sexual life? So where can they go? How much does it cost? Is it easy to get it? Yes, I would like to add to what Grosby was saying, that in the field work, the experience that we have when we work with youth is that when we find a minor that has an STI, how are we going to address this topic? But if this happens in a town or in a very isolated town, in a village or a town, we have to see the practices that go on there, because we have seen children, youth who are 14, 15 years old who have sexual intercourse with donkeys, with animals. And I have even heard with hens, and I'm not mocking them, but it's just a culture. And for them, it's common. It's like an initiation, and it's like normal. And for us, it might have seemed really bad, but it's a practice that they do. And first of all, they are doing it with an animal, and sometimes they are torn apart. We have seen dogs who have been torn, and they also have bacteria that are completely different from the bacteria that us as human beings have. So that's where it brings a lot of different diseases that could even be more difficult to treat. Yes, because we have the situation of these kinds of practices where the use of condom is not included. Why? Because maybe in their villages they don't know about sexual safety, but also because of moral things, misogynist and patriarchal things, they don't give access to boys or girls. So these kinds of conflicts come into play. And to give a comprehensive assistance to STIs in case of LGBTI people, for instance, we have the VISIT clinics, which are clinics for sentinel surveillance that are promoted by the organizations of sexual diversity. So within the Right Here, Right Now platform, you work in there, right? Yes, I worked for 2 years for the Kukulkan Association. They work with HIV, but it's an organization that is open, and they even do the HIV rapid test, and for syphilis as well, for the population of vulnerability. When we talk about population and vulnerability, we talk about gay men, and we also include men that have sex with men, but who do not identify themselves as gay. The medical term given to them is HCH. And what does that mean? Men who have sex with men, but they don't identify themselves as gay. So we have found a high rate of STIs in these people because these are people whose practices are hidden. These are people who have a wife and who make most of these practices without any protection. So these people start making this domino effect, like to the wife. And that's the example that I gave you from the women in prison. So in terms of, for instance, the VISIT clinics, the Kukulkan Association has a clinic that people can go to, trans people can go to, sex workers can go to, men who are gay, bisexual, who have men who have sex with men can go there, and anyone who needs a rapid test. And the test is completely free, and the result will get to you in about 15 minutes. And if you have a positive result, you can get a test to confirm in the same clinic. And the entire referral protocol is made, and as well as the support throughout the process. Do you also have people who are specialized in the area of psychology to give the news? In that regard, we are trained to give pre-counseling and post-counseling. We get touching points to give assistance from the reaction of the people. And we were trained by the University of Valle de Guatemala to give results in case of positive diagnosis, to be able to identify their partner or possible partners and give appropriate follow-up. Well, Grecia Grosbin, we are gonna make a contact to Argentina with Kellen so she can tell us about some of the stories or the experiences that she has had in this fight for the rights, and for her to tell us about this. Maybe the experiences in Honduras and Argentina might be the same, so we can go to Karen. As I said before, I was born with HIV, and the most frequent form of transmission is sexual. That is why I talk about the needs of talking about the HIV, and it comes with hand in hand with STIs. And youth forget about STIs because when you ask them, "Are you taking care of yourself?" they say, "Yes, I am taking the pill." But the pill is just to prevent pregnancy, and they forget about STIs and HIV. Or when they wear a condom, is just to prevent pregnancy. And that is of great concern because they don't give importance to the STIs. And the shame and the taboo that talking about sexuality brings is something that I want to break with Davis Foundation, because it's not out of morbosity or inappropriate or premature. It's just education. And us, the youth of Honduras, have the right to make informed decisions, and no one can take that right away from us. And that is why we continue fighting for us to have CSE, Comprehensive Sexual Education and Lay Education. And I'm going to repeat that as much as possible. Thank you very much, Karen. And something also important, Grosbin, is to talk about the achievements. So you have been fighting for so long and you have the legal knowledge. So what have you achieved throughout these years?
Throughout the years, the biggest achievement as civil society organizations working with HIV was to include in the national medication chart the antiretroviral therapies. Before, the antiretroviral therapies were not included in the national medication chart. Therefore, they were not bought, and we had to obtain them through donations from international organizations. Because of this struggle, last year, it's still fresh, last year through a strike, and with the help of the previous health minister, we achieved to include them in the national medication chart until the second line of antiretroviral therapy. I think it has been the biggest achievement besides this after the 215 reform. We also achieved to eliminate the recovery fee. The recovery fee was a payment that the person with HIV did in order to obtain their medication. So I come back to the same point. If this person did not have enough to feed themselves or their children, how could they pay for this recovery fee? And sometimes they gave it to them, but as a cumulative. For example, today they paid 25, tomorrow or the next time they pay 50.
They were taking advantage of them.
Not only this, but in many places we found out that that recovery fee was used to celebrate the doctor's birthday for the Wi-Fi network.
Don't tell me about those things because it makes me angry knowing that we are living in a country like this.
It's infuriating. There is a case that touched us during the pandemic. It was a case of a girl that died. As HIV Forum, this case touched us. They told us it's the terminal case of a pregnant minor with HIV.
Wow.
So we went to the hospital and we made them take her in. They were afraid because she was HIV positive. One of the phrases from the anesthesiologist was, "She's gonna die anyways."
That was in the hospital.
That was in the public hospital. So they take her in. Next day at 2 a.m., they told her she could leave. We're talking about a young girl in a terminal stage.
A
We were
terminal
turned angry.
stage and pregnant.
Yes. Yeah. When we arrived, the mother told us that they had asked her to leave. So we were extremely angry. So we came and we asked for her files, and they magically disappeared.
Of course, they couldn't leave any evidence of what they did.
So we did the whole process again, so they could take her in because she was going into labor, and luckily the child was born without HIV. I sent a kiss out to the child. So during the pandemic, her situation got worse again because being able to help them in a terminal stage is a very difficult process. There are opportunistic infections as streptococcus and other infections. And ironically, they say they died because of HIV or AIDS. They don't die because HIV or AIDS. They die because of other infections.
Okay, so we're about to wrap up. What is your dream? I feel that I am part of a community, of a group of people who are in a situation of vulnerability that is very high in our country. I think that part of my dream is to contribute, serve, and being able to educate people, to be in a moment where I can guide, maybe with the knowledge that I have been shared, and to give advice to anyone. And for that person to avoid doing some kind of practice that will put their life at risk, and not only at STDs, but being able to teach others, and no matter who they are, what is their orientation or gender, for all of us to be more responsible with our lives, to have more knowledge, and to get closer to these topics, which are so important, because at the end of the day, information is everywhere. There are organizations that have worked on research, on creating documents, on sharing information, to share lubes and condoms, and bring the tests and support these processes for all of us to be on those spaces and leverage those spaces. And my dream is for everyone to have access to comprehensive education, to the therapies, and also for morale, not to hinder getting to those stages. So real quick, because time is almost up, I just want to ask you to give an advice to the youth, because you live with HIV.
Do the test. HIV directly, the HIV doesn't kill. Ignorance kills.
I like that. Rosbin, Grecia, Keren to Argentina, thank you very much for allowing me, once again, to acquire more knowledge on the STIs, and also how we can educate a population that is completely ignorant of this topic. Thank you very much for being with us in this platform of Right Here, Right Now, Honduras.